Hey, breaking, fantastic news about convalescent plasma. The president went on TV a couple of nights ago. Convalescent plasma. That is the antibody that if you had the Rona and got better, you can donate. We have 68 people coming. The bus is actually coming here. It's different than giving a pint of blood, the red cells, because this takes an hour per patient. The first time in the history of blood donation, they're going to actually take the serum from our patients in our parking lot because we have tons of antibody patients. Love to have you part of that if possible. Now, the convalescent plasma, yeah, fantastic, approved nationwide. That's only given IV in the hospital. IV in the hospital for really sick patients. Our goal as family doctors is to keep you from even going in the hospital. If you remember the last video, that lady from Hong Kong, the MD, PhD, this virus not come from nature. This virus has been altered to ACE2 receptor. This virus not going to burn out. Therefore, with the cold and flu season coming, we got to be aware of asthma and the flu, and the symptoms overlap. So the key to the whole situation, as we went through before, 81% of people get better with Gatorade and Tylenol. The 81% that don't have asthma, diabetes, heart disease, young and healthy. So crucially important that if you get the Rona or think you're getting the Rona in the fall, that you stop the viral damage. Of all of these things that cause cat dander and the weather and pollution that causes a river of mucus, the virus, this little bugger down here, is the only one that tears up the lining of the lung, the cytokine storm. So you got to hit that early with the medication, the hydroxychloroquine, zithromax, zinc, and now a baby aspirin. Very, very important. And again, the CDC showed that hydroxychloroquine is safe in pregnant women, nursing mothers, children of all ages. So we can open safely. Kids can go to school, sporting events. The convalescent plasma is fantastic for hospitalized patients. Our goal since the first video in March has been to keep you out of the hospital. The only way we can do that is in the fall, because this virus was tweaked in the lab. It's not going to burn out. Anybody with asthma, heart disease, diabetes, obesity is also a candidate for prophylaxis. 1 pill a day of hydroxychloroquine, the Baylor study, the Yale study, and the Henry Ford study. I try to always give you the latest and greatest information, which brings me to my point. I quoted that study from 2005. I went to go find it for this quick little lecture today, and I got this from my search. It says, in order to show you the most relevant results, we've omitted some of the entries. In other words, I can't find that study again because it has been omitted from the search. This is the world that we live in right now. My loyalty is 100% to you, our patients, and that's it. So this is really important. They are literally omitting and scrubbing some of the old studies that I referenced from March. You guys, I don't care about your politics or any of it. I'm just looking out for your family and our community. And this is just the world that we live in right now when they're scrubbing studies and doing kinds of crazy things. My loyalty is to our patients, which are our family as well. So thank you so much for watching. If you get cold and flu season, please get seen early, because early is the key. Congratulations on the convalescent plasma IV in the hospital. We want to avoid the hospital. God bless and thanks.